Okay, so hello and welcome to the first episode of the ICC Academy COVID-19 Briefing, an interactive video series where we explore the economic and health implications of this coronavirus pandemic and what must be done to ensure successful recovery for individuals and businesses big and small. I'm your host, Thomas Paris, and in this episode, we will discuss why we need to crush rather than flatten the curve, lessons from the Ebola outbreak, and what policymakers should take from scientific experts to properly tackle the pandemic. With me is Yaneer Bar-Yam, Deputy Director of Trade and Investment at the ICC headquarters, and I'm very happy to also introduce our special guest, Yaneer Bar-Yam, President of the New England Complex System Institute. Thank you both for joining us on this very important topic. So these briefings will kick off a collaboration between the ICC, the United Nations, and the World Health Organization. During the session, we will start running through a few topics, followed by an audience Q&A. So we invite everyone to send over your questions through the chat and we'll go through them together. So let's kick things off. Damien, I know you prepared some questions and some topics, so the floor is yours.
Thank you very much, Thomas. So I just wanted to make very clear to everyone exactly what the purpose of today's call is. And that's really to help individuals and businesses understand the essential dynamics at play with the COVID-19 pandemic and discuss what practical actions they can take right now to help turn the tide against this disease as businesses, but also as individuals living in local communities and as citizens able to put pressure on their governments to react appropriately. And we're very happy to have with us as a guest speaker today, Yaneer Bar-Yam, who is not an epidemiologist or a business person or an economist or someone from an international organization, but first and foremost, a mathematician and founding father of complexity science, a branch of science concerned with complex systems, with things that are dynamic, unpredictable, multidimensional, and non-linear, like pandemics. So we're very happy to have Yaneer here as an intellectual leader in the field, but also someone who has recently become a very practical leader, marshalling a volunteer corps of thousands of scientists around the world to help end coronavirus. So Yaneer, perhaps with that introduction, I would just like to start with COVID-19 at its broadest possible level. As an expert in complex systems and someone who has studied pandemics very closely for many years, could you explain to us, to business leaders, the essential dynamics at what's at play here?
Sure. So when we have a complex phenomena, and this is something that's true about any problem that people face, it's really the main advantage that we gain is by restricting our attention to the most important pieces of information, because there are tremendously many things that one might talk about. But being very focused on what we need to know helps to eliminate a lot of the confusion about what's going on. And in this case, there are really three different things that we need to know. The first is it's a terrible disease, which means we don't want it, right? And so what makes it terrible? Number one, it has a 20% hospitalization rate. So 20% of the people who get it end up in a hospital for an extended period of time, for weeks. Of those, so of the 20%, about 14% are severe. People are having trouble breathing. There's a tremendous problem with their situation, but 6% are on ventilators. So this is not a regular sickness that we are used to. It has very, very severe conditions. In addition, of course, there's a fatality rate which depends a little bit on conditions, but a lot on the availability of treatment. And so it's about 2 to 4%. If people get good care, But of course, if the care breaks down, it's well over 10%. So the part of this which is deceptive is there's an 80% that are mild to moderate cases that have the disease and don't get it. And this is deceptive also, because if everyone got sick, people would understand how severe it is. But because some of the cases are mild, people sometimes don't think that it is as severe as it is. And it is a very severe disease. That's number one. Number two, it spreads very rapidly. So the easiest way to think about this is the rate at which it grows. And the rate at which it grows in the population is at about between 1.3 and 1.5 multiplier per day, which means that every week it multiplies by a factor of 10. And that's huge. So what was happening is that because there's so much infection going on, whatever we see today is only the tip of the iceberg in terms of what's actually present now. And if we act today in response to what we see, we're always behind, because we really should be taking actions that are in response to what's happening a week or 2 weeks out. And a week out is a factor of 10, and 2 weeks out is a factor of 100. And that's huge. So what this results in is that people get overwhelmed. And so it looks like it's very little because it's 1/10 of whatever supply or resource you have. And then all of a sudden you're out of supply and resource, and then you're underwater by a factor of 10. And that's what's been happening everywhere. People say, hey, it doesn't look so bad. There are all these mild cases, and besides, we're doing okay. And then all of a sudden, boom, we're against the wall. So it's really like being hit by whatever you want, by a 2x4. You're not hit until you're hit, but once you're hit, it's really a bad situation. The third thing that we need to know is that we can do something about it. And doing something about it means stopping the transmission as early as possible. The longer we wait, the dramatically worse it gets. And the longer we wait, the more rapidly worse it gets, right? So it becomes worse and worse, and it becomes faster, worse and worse. So if the sooner we act, the better. And we shouldn't wait an hour to act. And the reason we can act is that the same dynamical process, this dramatic rapid increase, if we act, can be turned into a dramatic exponential multiplicative decrease, right? Because it's the same process. It's driven by the contagion. So if we allow the contagion, it goes up. If we stop the contagion, it goes down. And the way to stop the contagion is to understand how it transmits. It transmits through physical contact, through coughing and sneezing, but also even through breathing the same air, and it transmits through surfaces. So if we breathe or cough or touch surfaces, those surfaces become contaminated. Someone else walks by, they touch the surface, and they can become infected. So spaces are not safe. So shared spaces, elevators, common areas, surely public transportation, all of the shared spaces become unsafe as soon as there is a sick person in it. And that leads also to super spreader events where many, many people can become infected. But the primary location of infection is with close contacts. So between family members, people who live together in the same space. So the disease is very aggressive. It spreads very rapidly. And the solution is to shut down the transmission. I can give specific actions to be taken. Maybe you want to ask another question.
Thank you, Yaneer. That's extremely clear and helpful. Perhaps just before moving on to solutions, I was wondering if you could expand a little bit on that second key element that you talked about, which is the multiplier effect, because I think the world has been inundated with graphs showing exponential growth They have seen images of showing flattening the curve, including dynamic images, often with no numbers on either the X or the Y axis. So I was wondering if you could explain a little bit about how, even if we can reduce the infection rate a little bit, we're able to exponentially decrease the number of people who are infected. And also talk a little bit about whether it is possible to flatten the curve or not. What should we be doing?
Right. Yeah, there's a lot of confusion about this. So if we have this kind of exponential growth and we take some action, and one of the actions is, say, to stop having large gatherings, right? So we eliminate super spreader events, and we maybe only allow 2 people to interact at a certain time. That will surely have an effect. It'll have an effect because we won't all of a sudden have hundreds of cases. But the underlying rate at which the curve is going out is not actually going to be affected by all that much. So that prevents us becoming overwhelmed suddenly in a particular location, but it doesn't stop the outbreak from increasing. And we can do other things. There are lots of things that people have talked about, washing hands and all kinds of things. It turns out that all of these things only affect it a little bit, because the basic transmission is between close contacts. So we really have to reduce the nature of close contacts, meaning sitting together with someone for dinner or something like that is creating a close enough contact that it creates a much higher probability of transmission. Now, what people have talked about is, hey, this curve is going up so quickly, maybe I'll flatten it out a little bit and things will be okay. What people don't realize is, remember what we said about the 20% hospitalization that includes 6% ventilators. Even if you slow it down a little bit, that curve is still going up so rapidly that we will overwhelm any system. It's like, I've seen these pictures of a tidal wave hitting a hospital, right? And they draw the tidal wave at about the height of the hospital. And it's not the height of the hospital. It's 100 times the height of the hospital and more. So if you have a tidal wave that's 100 times the height of the hospital, say, let's reduce it. We'll reduce it by 90% or 80% or 70%. It's still 100 times the height of the hospital, right? So that doesn't work. And the point is, let's say you could get it, so you would reduce it to basically the capacity of the hospital. So the disease would last for decades, right? That's basically what we're saying. The disease would last for decades. People would still be dying at 4%, and maybe we would figure out some better things to do a year from now or 2 years from now. But the point is that if we're doing that much work to reduce it to the height of the hospital, let's just stop it. Because the effort to reduce it by a factor of 100 down to what will be the level of the hospital, we can just do a little bit more and all of a sudden it goes down and disappears. So all of the discussion about flattening the curve doesn't actually make practical sense. If you're going to do that much, the difference from crushing the curve to actually stop it and make it go away is not that different. And not only that, if you go all the way, because it's an exponentially declining process, it goes away within weeks, really within weeks. And China showed this, and Hong Kong showed this. I'm sorry, not Hong Kong. South Korea showed this. Singapore and also Hong Kong showed that if you just have a few cases, which is what might happen after we go down exponentially, then we can control it just by doing contact tracing between close contacts, because that's the dominant way the disease transmits. So the trick is, if we stomp it really hard, right, and we get it to decrease rapidly, all of a sudden the whole impact of it is much smaller. We don't have to go through the wave this way or the wave that way or the wave that way. We can get rid of it and it's gone. And whether it affects a tiny percent of the population, if we do it really early, right? Or whether it affects 1%, which is where we are now. If we do it a little bit later, it's still only 1% of the total population, which is tiny compared to the impact that it would have if we just flattened the curve.
And so what is your prescription that governments should follow? When you talk about crushing the curve, are we talking about very extreme measures, lockdowns? How long do they need to be in place for? Is it a one-size-fits-all situation? We've seen many governments sort of waiting and waiting and waiting until they have a certain number of cases, and then they decide that it's time for a lockdown, or it's time for stage 3 or stage 4 or whatever categories they have in their decision-making process. What are the main things that governments should do or avoid doing as well?
So the first thing is they should avoid waiting. The dynamics of this disease are the same everywhere in the world. There's no, it doesn't depend upon ideology or culture or governmental structure. It's so basic. It grows at 1.3 to 1.5 multiplier per day everywhere. And so if you're at the beginning of that, there's no reason to wait. And if you're a little bit higher, there's no reason to wait. And if you're higher, there's no reason to wait, because we know exactly what's going to happen. And the longer you wait to say, hey, now I see that it's really bad, I'll take action. In fact, the worse it is, and remember, because you're only seeing the tip of the iceberg, at that point, it's going to be much worse than the moment at which you decided that you're going to act, by a factor of 100. So China acted with the lockdown when they had 800 cases. 800 cases. Everybody should look at what's happening in their country and think about the ratio of their population to 1.4 billion people and ask at what point they should be acting. What they ended up having is 80,000 cases. So they locked down at 800. They ended up with 80,000 cases just because of the underlying dynamics of the disease that couldn't be stopped. Okay? So that's really, really bad. And they sent 42,000 healthcare workers from all over the country to the epicenter in order to help stop it. And they were overwhelmed, and they built 14 hospital facilities for different levels of care, including core hospitals with 2,600 beds. Not everybody can do that. So the earlier you get it, the better. Now, what do you have to do in order to stop it? 3 things. The first thing that you have to do is actually travel restrictions. International travel and domestic, local travel restrictions, because the disease is never the same everywhere. It's heterogeneous. So if you stop all non-essential travel, you can focus on the areas that have more outbreak and not have it in areas that have less of the outbreak. And that's really important, because it gives you the ability to focus your resources. And like China did, they brought many other people from other parts of the country to help. So that's number 1. Number 2 is the lockdown. And the lockdown means the disease is so transmissible that everybody that is connected to someone, can be in contact with someone or in public spaces with them, may get infected. So you have to localize people in their homes, and even preferably, because most of the transmission is within homes, to atomize as much as possible. People should be as separate from each other as is practical. And then you have to arrange for essential services, and those have to be done safely. So supermarkets and groceries, pharmacies, they have to be set up in a way that enables people to be safe with a sufficient distance, masks, gloves, all kinds of things. You have to really go all out.
That's a really interesting point about what different businesses can do. But perhaps just before turning to that, I know you've written some really interesting things. Please.
Yes. The third thing is testing. The more you know about where the disease is and who has the disease, the better you can act. So testing. And South Korea showed that with massive testing, they could really reduce the level of other kinds of constraints that they placed. And again, they had a lockdown, they had travel restrictions, so you can't do without it. But if you have a lot of testing, then you know where it is and you can relax a little bit on some of the constraints. And because of the nature of the impact on people, on the economy, and on everything else, being able to focus your attention matters a lot. It tells you who to isolate as individuals. It tells you if someone is in a household, you get them out quickly. If you know, all of those things all have to do with testing.
That's a very good point about testing. And I know some governments now are trying to roll out massive testing on a scale that we haven't really seen before, especially in Europe. Which also leads to this question of how long will we likely be in this situation for? So I'm currently based in France, and we have been in lockdown now for probably 2.5 weeks or so. When we talk about a lockdown, how long does that need to take place for it to be effective? And how do we eventually open up again? And does that depend on testing? How long are we in this for? And if you're a business, this is important because your cash flow might last for a certain period of time. It matters for policymakers as well to determine how long they need to give loans to companies for it, and for social welfare payments, etc. What's the prognosis?
So the answer is, it takes until we get it right plus 5 weeks. Okay? And saying until we get it right means if we go all out, then we can stop it in 5 weeks. If we do it half-baked, it'll be forever. This goes back to this other statement. The disease is very tough to stop. This is like the hardest thing that we've ever done. This is the hardest thing we as humanity have ever dealt with. So we have to go all out.
5 weeks is not that long.
What?
5 weeks is not that long.
5 weeks is not that long. So the point is that it really pays to go all out. You know, socially, in terms of the humanity, you know, as people, you know, the death and the heart, the suffering, we should do it. And for economics, we should do it, right? The economics are following the fact that it's a terrible disease. So if we go all out, we will be much better. So why should we do half-baked things and think about, should I do a little bit more? Should I do a little bit less? Maybe we'll be able to, you know, get away with just a little bit of this or a little bit of that. And the answer is, that doesn't make any sense. And it doesn't make any sense because taking risks will only make it worse long term. Doing it halfway will only make it worse. And we can't see, we don't have visibility. Remember, we can't see now what's happening in a week or 2 weeks. So because we're blind to what's exactly happening, the way we know that it will stop is if we know that everyone's doing it. And this means governments have to do all out, companies have to go all out, and people have to go all out. So if your people are going to the beach, or if they're having, you know, clandestine parties, or if they're doing other things, it's going to take a lot longer. So everybody has to take responsibility. In Italy, they created a national lockdown. And it kind of seemed to stabilize, and then it shot up again. And the people who were advising them from China said, people are just not taking it seriously enough. Now we're beginning to see that it may in fact be going down. But they had to show that they would fail before they did it. Don't do that. Take it very seriously, and then we'll be done. Why does it take 5 weeks? It takes 5 weeks because of the incubation period. There's a typically 3 to 5 day incubation period, which is very short. And that's why it goes very fast, because the people who are sick just get infected now. Within 3 to 5 days, they're infecting other people. In fact, they can infect people most likely before they show symptoms. So basically, as soon as they become infected, they're almost ready to start infecting other people, which is zip fast, right? Okay, and that's why the disease propagates so fast. But symptoms can show up until 2 weeks later. So there's this long period where we don't know who's sick. So if we lock everyone down, let's lock everyone completely, then it takes us 2 weeks to discover who's sick. We have to take them out of where they are contagious to family and friends and roommates. And then it'll take another 2 weeks for the people that they infected, for them also to become clear that they're sick. Mm-hmm. By the time we're in the second 2 weeks, it's falling rapidly. And by the end of 4 weeks, we're very tiny compared to what we started. And maybe it takes another week for us to kind of clean up things in the core of the outbreak in Hubei, in Wuhan, in China. There were cases at that point, but those cases were all already known cases. So they were already isolated. So by 4 to 5 weeks in areas that are not very highly infected, we're done. In areas that are highly infected, where we focus our attention and stomp it out at the very end, it's 5 to 6 weeks.
Okay. So we have actually a few questions. Oh. Sorry, I was just gonna. I think we're looking at the same thing. So just to bounce off of that, I have a few questions coming in. Some of them are similar.
Before we ask other questions, sure. I do want to answer what businesses should do.
Okay, I was going to go into that actually, but
okay,
go ahead.
Go for it.
No. Well, essentially, I'll just cue you for what you were going to say. It's a question from Julian and also echoed from a few other people. Is basically just asking about the supply chain difficulties that are impacting businesses now and what they should be doing or what they can expect. So maybe with just that prompt, maybe you can just cover what it is that you had originally planned.
So before I get into the supply chain difficulties, which I can address, I think it's more generally important to address what businesses need to do as a structural question. And I think the answer may be fairly clear, but let's go over it. Number one, anybody who can work at home should be working at home. That's obvious. Number two, where people absolutely need to be in contact, and that includes essential supply services and so on. And of course, in healthcare settings, which is the most dangerous situation, people need to be very, very careful and develop new and special protocols for this time. So supermarkets and pharmacies, as much as possible, home delivery or pickup, whether it's curbside or parking lot pickup, since it may be difficult to create custom orders, to create generic sets of things. There's a supermarket near me that has 2 different boxes that people can come and pick up. They order them, pick up in the parking lot. Okay, so that's one aspect of it. The second aspect of it is the people, right? Your employees and their interactions with each other, their interactions with customers. What can we do? And the answer is precautions, distance, mask, gloves. But there's another side of this that everyone should be aware of. Whether they get sick or not, and whether they transmit to others or not, depends on their home situation. So we have to reach to them, find out what their situation is, find out who's at risk, and act to protect them, right? If they're at home and their partners or their immediate relatives that are home with them are, for example, healthcare workers or are doing something else, it's really important that they be protected and that your business be protected at the level of what they're doing at home. So what they do at the workplace, or even trying to arrange or seeing if they will be possible to arrange from the alternative accommodations. And for healthcare workers, this means people don't want to bring their disease home. They will get sick in healthcare settings. So having them be in other places than their home settings may be saving lives. And this is also true, and this has been very apparent for high-risk institutions, right? Nursing homes, prisons, rehab facilities, any place where people are together, they really have to be protected. It is being brought in by the people who come in the door that have to come in the door because they're the employees. So these are some of the issues. Now, going to the supply chain stuff, there will be disruptions, right? This is a severe situation. How do we deal with it? And the answer is we have to work very hard with the specific circumstances. There's no general solution to this. There are specific circumstances that we have to address. If people want to ask me very particular questions about how to deal with this, I'm available. My email will be put up, Yaneer, my first name, at necsi.edu. I'm happy to talk with people about specific circumstances, learn what are the specific challenges so that we can develop them into broader guidelines that many people can follow.
Fantastic. Thank you, Yaneer. I might jump in here and ask a question which has come from one of our colleagues at the International Chamber of Commerce in Belgium, who has asked, I think, a very important question about whether or not there is a trade-off between economic outcomes and health outcomes, or whether, what it seems from what you're saying, they are one in the same thing, that the economic damage will be minimized if we act now and on as big a scale as possible. And so therefore the economic damage will last for 5 weeks. The shutdown will last for 5 weeks, but no longer. Or is that incorrect? And
yeah, I mean, when you're hit by an exponential,
how do we convince governments of this?
Yeah. So, and the answer is you have to tell them, right? They listen to business. And so they're concerned why, the irony of this is that the biggest concerns about economic impact are being raised by epidemiologists who don't have economics training and don't understand the interiors of business and are thinking about this as a social disruption that will have economic impact. And they need to be told by people who understand economics that a 5-week disruption that is sharp is much better than an almost as sharp economic disruption that lasts forever or a year. And this is really what people don't understand. The other thing, and this is also relevant to the previous question, when there's a short time impact, it's really important to realize that everything depends on everything else. Right? That's what supply chains are about. But because it depends on everything else, there may be non-traditional partners that can help. Whether, and some of this might be government, right? Government is trying to bail out, the economic activity because, of course, nobody wants the economic activity to go away because that's bad for everybody. So, but the point is that government can help. The military may be able to help, but many, many people, many organizations can fill in gaps that are present. And we need to be creative and think about it. We've created a lean supply system, assuming that it will always be there. And that wasn't wise. And if you asked me before, I would have told you, but everyone wants to optimize profit. So if they optimize profit, they're not optimizing robustness or adaptability, which are both essential to disruptions. So you didn't prepare for this. So you got caught with your pants down. Sorry. But now that you're caught, realize that there are many, many resources that are available to overcome localized problems. And that's what we have to do. So we can get in shape and do things if we allow ourselves to recognize that the society, even though we've been building a lean system, has a lot of opportunity for help. And that doesn't mean that everything will work, but it's in 5 weeks. A lot of things, most things, and hopefully mostly the essential things will work. And if things get broken a little bit, we may be able to pick up the pieces and restore them. The point is, you also asked, how do you restore? And the answer is, you restore it, first of all, by understanding geographically, right? So if there are places that are easier to restore, you can do those first. And then you do it progressively. You go in, you turn on the lights, you see what got broken, and you fix the things that are essential, and you send in a few people to take care of necessities, clean it up, and so on. But then you build up. And I don't need to tell everyone specifically because you know your businesses, but you know what needs to be done first and what needs to be done second and third, and you develop a plan for it and you execute on it. And it hopefully doesn't take more than, few days to weeks, and then so after the 5 weeks, we're back up and running in a couple of months, and maybe a little bit longer, but shouldn't be much longer than that.
Right. I think the geographic component is actually very important. We've been getting some questions coming in, one from Omer and the other from Juliana, specifically on what types of advice you would give to third world countries during this. And then just echoing on that one is any thoughts on how the government could control the lockdown in slums and favelas? Because a lot of this advice is feasible for first world countries or developed countries, but for developing nations, I don't know if there's anything specific that you want to add in.
Yeah, well, again, the sooner people act, the more options you have, right? I mean, because you can do things that require more planning, preparation, facilities, and so on. And there's no doubt that the main thing is atomization, separating people, right? In favelas, they're right on top of each other. So it would travel through there, or again, in townships, or in places where people live, 10 to 20 in a household as opposed to 1 to 2 in a household, right? I mean, that's where we're going to end up. This is the craziness about cruise ships, right? Because cruise ships are like prisons in the same way, or nursing homes. Everybody's on top of each other, right? So how do you solve the problem? And the answer is you don't shut off the cruise ship, because then the disease propagates through the cruise ship over months, right? And everyone gets infected. So what you want to do is to separate. So where there's high density people, we have to figure out ways to bring them out. And bring them out means, if the climate is good, to the countryside, set up tent cities, right? We have refugee situations where we set up tents and we work. And if it's just a blanket, if the climate is okay, when it's rainy season, then we need tents. Something. We have to set up something so that people can separate into the smallest units that either the people themselves or the capability of the facilities will allow.
And just to bounce off that comment a little bit, are you seeing examples of better or best practice in that regard in separating people into the smallest units possible in different parts of the world? Most people are concentrating very naturally on what's happening in their region or their country, but obviously South Korea and China have managed to tame the disease. I think we may have lost Yaneer for
I'm on audio,
a moment.
So my video is
You're
down.
on audio? Okay. Okay. But are there specific government actions that you have seen, or even actions by businesses or families or communities that are particularly effective in doing that?
So there are a few things that have been done, but then there are things that have not been done that would be even better. And so let me talk about what has been done. First of all, going door to door to find out who has symptoms and separating them from the household is a very key process. And the door-to-door process eventually is almost essential, right? Because you don't know what the compliance is. So it's good to have, and this is what we did in West Africa to stop Ebola. You go door to door, you measure fever, and you isolate the people who have fever. And this is key, because what you do is you treat communities as being infected rather than individuals. So that's the door-to-door process. So crucial. The sooner you do it, the better. But surely, as the disease, I mean, people are overwhelmed, right? So they don't know. First, you do the lockdown, right? That's the most important. And then, as soon as possible, set up door to door. And recruit the communities, because as we did in West Africa, communities taking responsibility for their own health is much better than trying to send in, foreigners or troops or whatever that are going to be maybe not trusted by the communities. So the communities themselves are the most important actors, because 80% of transmission is within family groups. So if you really want to cut it down in terms of the total number that get infected, that's key. The second part of it is indeed this business of testing. So if you test people and you know that they don't have the disease, even though they have fever or whatever, then you don't have to isolate everybody, right? So you can choose those people, and it reduces the burden in terms of the action by dramatically. In South Korea, it's only 3 or 4% of tests that are positive, and in the U.S. it's now at 20%. So 1 in 5, and the ratio is bigger for mild cases. So you have to expect kind of 1 in 20. So if you don't do the testing, then you have to isolate 20 times, whatever it is, something like 20 times as many as you have to isolate if you actually do rapid testing. So doing the testing really helps. So those are two parts of it. Now, the part of it that has not been done, that should be done in order to really lower the curve. So right now in the United States, we're getting to 200,000 cases. And if we project to what's happened in China, surely we have to expect at least 10 times, maybe even 100 times, millions of cases. If we really wanted to stop it, we would recommend to people to self-isolate within family. For a week would be very good, right? Because most of the transmission happens in a week. For 2 weeks would be outstanding, because by then we would know everyone who's sick and we could go back to living normally if people don't have symptoms. So 1 week to 2 week isolation, even within families, would change dramatically the impact of the disease. There's one other thing that I would say, and that is that, remember, 80% of cases are mild. And many of the cases, most of the cases that become severe, they take time. So there are some people who are elderly that get severe quickly, but even then, it often takes time, a week, maybe 2 weeks before they get severe. And it's clear that what the outcome is depends very sensitively on how healthy you are, right? We know that. People with underlying conditions, they become sick much more readily than others. But because there is this big a ratio of people that stay well, the best thing that we can do is increase the percentage of people who stay well and people who don't progress. So there've got to be a fair amount of levers that we have that we can change that. So what should we do? And the answer is obvious, right? You do the basic things that keep people healthy, right? You drink a lot, right? When you're sick, what do? You drink a lot, you eat well, good soups, fabulous, right? Chicken soup. You sleep well, you take care of yourself. And by the way, one of the things that people don't understand is that you shouldn't put down your fever unless you have dangerous fever. Fever is part of the way the body fights the disease. If it's 101, let it. Your body's fighting the disease. Give it a chance. The other things that you do deal with respiratory health. So respiratory health means you're breathing. So you want to exercise, you want to strengthen your cardiovascular, you want to do it, and not as much as you can reasonably, not to excess, because that will weaken you, but just enough to keep you going and to strengthen you. And breathe. And fresh air. Fresh air is huge. And if you're in a city, get a HEPA air filter, purifier, because what you're doing when you're sick is you're breathing out virus. And surely you want to protect other people, but what you want to do also protect yourself. And it just makes sense that you don't want to keep rebreathing the virus that you're breathing out. Now, whether that has a huge effect or a small effect, I don't know. But any effect that it has will save many, many lives if we're talking about hundreds of thousands or millions of cases.
That point about breathing in and out the virus reminds me of a question that we discussed separately, Yaneer, about masks. Could you tell us a little bit about your view on masks, who should wear them and when?
So the answer is the preferred situation is clearly that you're away from people. And if you're away from people, you don't need a mask. You don't need a mask if you're well, and you don't need a mask if you're sick. And you should just clean up, right? If you're sick, you should clean up the space so that you get the virus off the surfaces too, and wash your clothes. But the point is the following. The only time you need a mask is when you're near people and they may be contagious. So one of the key points is the following. Reduce the amount of time that you have to be near people. But if you have to be near people, if you don't know that you're sick, or if you're sick, if you're near people, people should be wearing masks. And the reason is that the first thing is to stop it from getting to people who don't have it. Okay. And all of this discussion about masks might not be good, masks might be good, it doesn't make any sense. Wearing a mask prevents people from transmitting from one to the other. Okay? It's transparent, it's clear. This is how the disease is transmitted. It should be done. And there's an article recently by Sui Wang, which is talking about it. And the only reason why we can tell that the government said it is that there's a shortage of masks. Okay, so there's a shortage of masks. We have to solve that problem. And the mask that you may use at home might be a homemade mask. You can make a mask out of cloth, have someone else make a mask if you don't know how to sew. You can use a scarf or a bandana. That's what the CDC says. If a healthcare worker doesn't have a mask, wear a scarf or a bandana. So if it's good for them, it's surely good for everybody else. Now, the piece of it that creates a little bit of a paradox here is, again, if you're rebreathing your viral particles, it's probably not good for you. So actually, if you're sick, it's 100% better not to wear a mask. So make sure you're away from people, breathing fresh air. So go into the outdoors where you're safe and you're not going to infect other people. And breathe in and breathe out in a different direction. So when you breathe in again over here, you're just breathing in fresh air. Or do it through a window. That's an advice that it just makes sense. If we all do it, maybe it'll help a bunch of people. It's surely not going to hurt.
Mm-hmm. So I am mindful of your own time. I know you're very busy at the moment. So I'm just going to go through a few questions that we've gotten here, and then after that we can start going through some of Damien's final points. One question that we got from Zach is actually a really interesting one. Is if you could discuss the ethics of starting a business during this time, and specifically businesses that are helping fend off the pandemic, because everybody's trying to pay their own bills, and what you think about the ethics of starting those kinds of things.
So this is an all-in effort, right? We're trying to do everything we can to help, whether, if we need more masks or we need more PPEs or we need more whatever. It's really crucial. And economics is the system whereby we do the things that people need. So there's nothing wrong with economic activity that's geared for helping. That's what economics is supposed to be and often is for, right? People pay for what they need. Of course, people might ask themselves whether, price gouging can be an issue, right? Because then you're preventing people from getting things that they need. And so we definitely, we're trying to do an all-volunteer effort, right, where we're going all out. Not everything can be done that way. So to the extent that there is need for financial means to be able to support activities, absolutely. If you're trying to make a killing, hey, maybe that's not the right approach.
Yeah, pun intended. So we had it originally.
And again, and it goes back to this thing. People think, there's this different perspectives on economics. Some people idolize economics and say economics solves all the problems of ethics, right? Because we don't have to be ethical because economics takes care of it. And there are other people who say, hey, I'm just going to get my own and I don't care what economics says. And there are other people who say, hey, economics is bad, we need regulation and all this stuff. And as a complex system scientist, I can tell you none of those are true. Right? Those are kind of ideological views that have sort of one short sentence answer to the complex problem. And the answer is economics helps in some ways and can hurt in other ways. And if you use your common sense, you'll understand when it helps and when it doesn't. So let's try to make economics work for us and not against us in a time of crisis. Everybody needs to help and everybody can help. And if part of what you do and are capable of is creating effective supply chains for a short amount of time that will actually help people, and that is a benefit, let's do it.
Mm-hmm. Another one I had goes back to public policy, and this is a question from Jenny, where she is asking about the initiative of some governments issuing passports that are specifically for those who are immune or those who have COVID. And if you have any thoughts around, whether or not that's something that will actually help in any way.
Sorry, say it again one more time carefully.
Sure. So the question from Jenny is around the government's thinking about issuing passports to people who are immune or have had COVID-19, and whether or not there's any merit to issuing that sort of policy on a government level.
So let me sort of articulate my perspective, and it starts back at the beginning. And back at the beginning, I said, if we go all out, it will be gone in 5 weeks. I think we need to focus our attention, and really all of our attention, on the big issues, and not try to fine-tune too many details. And at this point, I see that as a really fine-tuned detail. I think we really need to focus on the things that are going to affect the big picture. And one of them that I didn't talk about, that we really do need to understand as being a key big picture thing, is the medical response itself. Healthcare workers are going to get sick, they're going to die. The facilities are going to be overloaded. People are going to be dying because there's not enough equipment, there's not enough care that can be provided to them. And that's happening already. I mean, it happened already in a big way in Italy, it's happening in Spain, it's happening in the UK, it's happening in the United States, and it will happen everywhere where people have waited, which is almost everywhere. So let's focus our attention, whether it's policymaker attention, whether it's business attention, whether it's everybody else, scientists' attention, on making sure that we go all out in stopping this disease, and then the mitigation part of it, which is at the disease level, but it is really saving lives, is making sure that we save every life that we can.
Okay, Damien, did you want to go into any of the remaining questions that you either had on your end or that we've been getting through the chat, or how would you like to tackle the last few minutes? No, yeah, we can hear you. Okay, it's no big deal.
Well, one question that has come in, which is touching on a theme that we've spoken about a fair bit so far, is lockdowns. So India has just announced a lockdown for 21 days. Is that sufficient for a country with 1.3 billion people?
So we know what the right time scale is. It's 5 weeks. So what will happen is that if people say, I'm going to do one for 3 weeks, there are two things that might happen. One is it won't be strong enough, in which case either the cases will still be increasing or they'll be steady. Or if they did it well enough, it'll start decreasing at that point, but there'll still be too many. So my guess is that people will adjust their expectations as they get further into it. So I'm not that worried about the time that they say. I'm mostly worried about whether they're going to do a hard lockdown and go all in. Because if they do a hard lockdown and they begin to see the results, at that point they will understand how much further they need to go in order to make it stop. So 3 weeks is okay, because by then it'll start going down and they'll say, okay, let's do it for another week or two. And 2 is the right answer.
Okay, well, I think that probably covers most of the questions which have come through. So, I mean, from my perspective, there are some very clear messages that you've brought us today, Yaneer. One is the absolute imperative of acting now and acting at the appropriate scale, which is a massive intervention, lockdowns, tracing, contact tracing, massive testing. It is in all of
and travel restrictions,
and all of society, travel restrictions, that it's an all-in effort. That business has just as much of a role to play here as governments and individuals, families, local communities can all do a lot to help stop, not just arrest the spread of this disease, but make it decrease at an exponential rate. So there's a glimmer of hope in here, in these messages as well. You've given us some great insights, and I'd just like to say again, thank you very much. And we very much welcome both, as I mentioned at the start, your intellectual leadership here, but also what you're doing in your spare time through endcoronavirus.com. marshalling this big group of volunteers to help get the messages out. We're at the International Chamber of Commerce also very pleased to have worked with you to put together some business guidelines. And so we very much appreciate both that and your work today. So thank you very much, Yaneer.
Thank you. Let me just say, before you say it, I also appreciate very much the collaboration, but please be sure it's endcoronavirus.org.
Oh, what did I say?
You said .com, so it's endcoronavirus.org.
That's because we're so commercial at the International Chamber of Commerce. Okay. Endcoronavirus.org. You're very, very right. Thank you very much, Yaneer, and best of luck with all of your continuing efforts so that we can end this coronavirus together.
Thank you. And if anybody would like to partner with us on any aspect of the response, we have multiple channels already that are collaborations with businesses. We're very happy to create channels of communication or channels of collaborative effort. Again, this is all an all-in, everybody effort. We're very happy to work with you.
Great. Well, thank you both for your time, and thanks to everyone who was in the chat asking questions. I know we tried to get through as many as we could, but we appreciate the entire audience making time for this. I think it's really important. And as a reminder, we are hosting live broadcasts on this topic in addition to the regular trade topics like the Incoterms rules, cryptocurrency, leadership coaching, and others. So sign up on our website for free and subscribe to our YouTube channel. We look forward to doing this again. So thank you again for your time, both Yaneer and Damien. This has been really great.
Take care.
Thank you, Thomas. Thank you, Yaneer. Bye-bye.
Bye-bye. See you next time.